Okay, just waiting for Facebook to do its thing. And we are live. Excellent. Okay, hello, beautiful members in Helping the World Sleep Better. Emma Woolrich here, and we welcome back our amazing Dr. Sue Peacock from the UK. Welcome, Sue. Thank you. Nice to be back. It's just a lovely way to finish the week having a conversation with Sue. I've grown to love these conversations that we're having. And tonight we've got a painting behind us that I just chose. I thought that it just reflected, hello there, Jane, lovely to see you. Jane's also from Australia. Hi. To just reflect the topic that we're going to talk about tonight, or that Sue, you're going to share hints and tips about pain management and sleep. And it just feels as though, you know, if you are in pain, you want to be like those birds and be able to fly away from your pain and just have a beautiful night's sleep. So before we go into our interview, I was just explaining to Sue, our community is growing really rapidly, and we're now at 269 members in just over 4 weeks, which is really quite incredible. So our topic, that's right, Jane, you do come originally from the UK, she just lives in Australia, just like me. We call Australia home now. Absolutely. But one of the many things in our group that right from the start, when this group started and we were in lockdown, and it was one of my personal pledges that, you know, we'll bring global sleep experts to you around topics that we're struggling with. And I know with a lot of my clients that I speak with, you know, they love what we do together, and it helps them receive a beautiful night's sleep. But in the background, they've always got this pain issue as well. So the fact that tonight we're talking about pain management and sleep, there's going to be a lot of interest around all of the hints and tips, Sue, that you're going to share. So thank you in advance from everybody. Thank you. So for the people who are new to our community, we've had quite a few join even in the last week. And people who have not yet met Dr. Sue, please go and have a look in the group, or go onto the YouTube channel, Helping the World Sleep Better, and just have a watch through all of the previous interviews that we've had with Sue. They've all been fascinating in their own way. But before we go into the interview, a little bit about Sue, so you can really understand the expertise that we have and how privileged we are in this interview tonight. So Dr. Sue is a leading consultant health psychologist registered with the Heath and Care Professions Council. She's an associate fellow of the British Psychological Society and a registered advanced clinical hypnotherapist with experience helping clients with sleep disorders, chronic pain and clinical depression for over 20 years. So heaps and heaps and heaps of experience here. She has an extensive track record of supporting clients presenting with sleep disorders, and she won a research grant to pioneer her sleeping with chronic pain program from NHS Health Innovations, obviously in the UK. She's also a published author, and you can see there in the background to her right, Sleeping with Pain, which is exactly what she's going to help us with today. And yes, those books are available, and she'll post all of the links below this post later on. She's been featured in academia and by the media for her work, and she works with an empathetic, practical manner with clients and recognises the need to support clients to move forward on a practical level. She has experience of working both in the NHS and private practice. Sue, welcome back. It's, like I say, it's so lovely to have you here. So before we go on, oh, thank you, thank you. Before we go on, obviously you're a published author, you have a number of books that you've written. Can I ask you, Sleeping with Pain, and the fact that a large part of your practice is around helping people with chronic pain, why is this such a tough topic for people to try and navigate for themselves?
I think it's such a tough topic because it affects so many people. Pain is one of those, and sleep are sort of those co-directional relationships. So if you have pain, you can't sleep. If you're not sleeping, you experience more pain, or you notice that you've got more pain. And the research shows that, depends which paper you read, but between 50% and 89% of people who have pain experience that sleep disturbance. Wow. And it's quite interesting, because most pain management programs, for example, would only have a little hour session on sleep, and I thought, well, this isn't good enough. So that's what led me to develop the program Sleeping with Pain. That the book is now it's pretty much the program in a book, because so many people, as I say, report insomnia as their primary reason for not sleeping with pain. And what they find is most people with some kind of joint pain or arthritic pain, they seem to have more issues with their sleep, but I guess it's because they just can't get comfortable. A lot of people experience what they call it sleep fragmentation, but it's basically waking up in the middle of the night. They wake up, they feel quite unrefreshed, and that's because they often experience that sort of slow wave sleep. And they also, pain people report things like restless legs or sleep apnea or things like that. But the reason it's such a problem is because pain is basically a sensation that you feel when your nerves are stimulated really, really intensely, and this stimulation sort of activates the brain, so therefore it's keeping us awake. So It kind of disrupts us in so many ways. So it kind of disrupts what they call the sleep structure. So we all need that certain amount of sleep to feel rested and for proper memory and things. And those stages include the light sleep of stages sort of 1 and 2, the deep sleep of stages 3 and 4, and then that REM sleep where we dream. But we usually go through these cycles sort of 4 to 6 times a night. But when we're woken up because of our pain, we spend quite a lot of time in those lighter stages of 1 or 2. We have a shorter amount of time in the REM sleep. So that may lead to that increase in pain sensitivity. It's still quite unknown yet, but that's what the theory is at the minute.
Yeah.
We also know that it's very difficult to get comfortable when you have pain, isn't it? You spend a while sort of tossing and turning and sorting out your pillows and trying to get comfortable to start with. You eventually nod off, then you get stiff, and your pain gets worse. So not only have you got the pain that you have, you've got that stiffness pain. So you've almost got a double pain that feels like an exacerbation of the pain that you've already got. So that sort of stops you staying asleep, because you kind of notice it and it wakes you up, and then you can't get comfortable again and you get stuck in that cycle again, which is really frustrating.
I suppose when you're, it's the dead of night, and normally there's a load of stuff going on around you during the day. So even though you're in pain, it's like a managed level, because the brain can focus on other things as well.
Absolutely. Yeah, I think nighttime pain is the worst, because like you say, that you can't really wake up your family, can you? Just for a little natter, and you might nudge your partner and hope that they're going to wake up so you can have a chat and distract yourself. But there's not much on TV, so it's usually repeats or whatever. And equally, if it's a bit, it's coming to summertime here, but it's not for you. It's probably a bit chilly if you decided to get up in the middle of the night now. Because you're cozy and warm in bed, you don't actually want to get up, do you? So you kind of try and put up with it.
Yeah.
And I think, all that sleep deprivation makes you more sensitive to pain. And even they did some research quite a long time ago that found even people who didn't have long-term chronic pain, who didn't sleep well, were more sensitive to pain.
Wow.
So it must play such a massive
why is that, Sue? Why is that?
Yeah, it's because when you're sleep deprived, there's an increase of these inflammatory chemicals called cytokines. I can never say that word, cytokines. It's one of those words, you can think about it, you can't say it. If you just say it, it comes out. So it's because it produces those, and it's that inflammatory thing that increases the pain sensitivity.
Okay.
But also, there's a bit of a double-edged sword, because pain patients a lot of them take pain medication. And some medications, such as the opioids like codeine or morphine, they can actually cause insomnia. And sometimes they can cause sleep apnea, which is that brief pause in breathing when you sleep. So it's a really tricky balance, because, you know, do you take your pain meds and get some pain relief but not enough sleep, or do you reduce the dose and get some sleep but you're still in pain? So it is really difficult, because it's a hard balancing act. I think sometimes you've got to work out what works best for you, and everybody is so individual that that's always difficult, isn't it? I think that's the other
fascinating introduction. So we've got a couple of people watching with us right now. So for everybody who's watching us live, if you have any questions, if you yourself are, you know, somebody who regularly is in pain, finds themselves in pain at night, and Sue's describing exactly you, and you know, you've tried a number of things, you've been working with your medical practitioner or maybe a naturopath, and you know, you've got some specific questions, please post away. If you're watching this afterwards and you're interested in finding out more around how this works, maybe for a loved one, or you know, somebody that you know, and you'd like to be able to direct them in a certain way, and again, please put #replay below and tag myself and Sue, so that we can help you and direct you in the right way. So Sue, obviously people will, at some point in their life, everyone's going to have pain, be woken up with pain in their sleep. But it's the people who, it's not the acute side of things. We're really talking about the people where this goes on for months and years, and they're just trying to find, as you say, this balance. What are some of the strategies you share with your clients?
I think the top few strategies I share would, first of all, this is really hard. Be patient with yourself. Okay, life is not the same as it used to be. Okay, it may once you start to make changes, I'll talk about in a minute. It may take a little while for you to notice. So be patient. It's a bit like once upon a time, if you started some exercise or something, you don't go in the gym and lift the heaviest weights to start with. You know, you have to build it up really, really gradually. It's the same with all kind of pain management strategies. So do be patient with yourself. Don't be tempted to overdo things, because you end up putting yourself up in a flare up, and then you get frustrated and annoyed with yourself, and then your pain gets worse because mood influences pain. So remember to ask for help. There's always people out there that will help you if they can. Like Emma's already said, if you want to put some questions below for me, please do. Equally, if you feel a bit awkward about putting them there, just send me a message. That's totally fine too.
That's really just
you know, just don't suffer in silence, because there are people out there that can help. But appreciate that all strategies, all pain management strategies take time and obviously a bit of effort. I think one of the most important ones is pacing. So what we find is quite often, and we've all done this, you have chronic pain patients seem to have, in terms of their pain, good days, bad days, or some people say to me, bad days and worse days. But it's about what works for them. So on a better day, what people tend to do is think, oh, well, it's not too bad today, so I'll do this. Then it gets to the afternoon and they feel absolutely exhausted. The pain's gone through the roof. They feel really upset and cross, and so the pain gets worse, and they get put in this flare up, and so they don't do anything for a few days, and the pain subsides a bit, and then they go back into this sort of boom and bust activity cycle.
Right.
So pacing is key. So it's about almost having a rest before you need one. So even if you say you've got some gardening to do and you've got 12 plants, what I'd say is don't do all 12. I would say do 6, see how you feel, go off, do something else, go and get a cup of tea or whatever, and reassess how you feel. If you feel a little bit up to it and it's a couple of hours later, perhaps do another 3, see how you feel, then perhaps maybe do the last 3 tomorrow. So it's about pacing it out. So what you don't end up doing is overdoing it, getting cross with yourself, your family saying, you should have asked me for help, which really doesn't help me.
No.
But it kind of makes you feel worse. Yes. Absolutely. so pacing is key. There's lots of different ways to do it. You can do it like that. You can do it by time. You can even do it by how much pain the activity causes you, and analyse your day. but that'll take too long to explain. But if you want to know that, just let me know and I can explain it for you.
Okay.
I think it's also important to set yourself goals and targets.
Yes.
And break them down into really small things. So, for example, if your goal was to go and swim 10 lengths of the swimming pool or whatever, and you hadn't been for ages, there's no way you're going to go in there and do 10 lengths, because that's just going to put you in a massive flare up and put you off swimming forever. So if it could even be as small as finding out where your local pool is. That could be your first little target towards your goal. It could be seeing you've actually got a cosy that still fits and buying a new one if you haven't. It could be finding out the times of the pool where the kids aren't jumping in and all that kind of stuff. So it's a gentle swim, or it could be a ladies only session or a disability session, or those kind of things. And then you build up so you eventually get to the pool. The first time you don't even have to swim, you can just float about, and then perhaps you can do a width and 2 widths, then a length, and then eventually you build up to the 10. So it's about small achievable steps. I think they're the key things. I also think,
sorry to interrupt you, but what I'm really hearing from you is people who have chronic pain it's know your limits. It's know your limits and build it slowly, so that you're not in a position where you're creating your own cycle of flare-ups, but that you're being, as you say, patient with yourself.
Yeah, it's about sort of building up slowly. So say if you've got a goal that you want to do, but it's building up slowly, and then when you get to that goal, it's about reassessing. So when you get to 10 lengths or whatever, is 10 lengths enough and that's fine, or has 10 lengths sort of loosened you up so you can do some different exercise, or do you actually really like swimming so you want to stay there a bit longer? So I think that's a good thing. I think relaxation is absolutely vital. I think it's vital for pain management and for sleep, to be honest. So there's all different sorts of relaxation, isn't there? There's sort of progressive muscular relaxation, which I just call tense release, because that's what it is. And I'm not one for psychobabble. I say it as it is. And then there's sort of autogenic relaxation. There's mindfulness, there's meditation, and self-hypnosis. So I think all of those kind of things, it's about finding which one suits you. It's about probably trying all of them, but finding which one suits you and which one you like, because if you like it, you're more likely to do it. If it's something that feels like a chore, you're just not going to do it. There's a really good website called the Pain Toolkit. I'll put a link to it later. It's really good. It's a very excellent pain self-management toolkit, and it's written by a guy who has had pain for absolutely ages. And what's really good about it is it's got lots of videos, lots of short articles and things. It's all written in a really easy to understand kind of way. And we appreciate that, people with pain don't always have brilliant concentration. So it is small, succinct articles that you can kind of read. So I'll put a link to that if anyone needs it, because it's pretty good.
Right. Thank you, Sue. That's really, really good. Really amazing. And if we've got people who are watching this right now and they're like, okay, that's all great, that I can put that on my plan and I can start doing that. Nobody's ever told me or helped me think about it in that way before. What about the people who are in the chronic pain right now and they're thinking, gosh, I know it's bedtime soon. I've done everything I can with my pain medication. What do I do now?
Yes, I think for those people, regardless of what pain you've got, so whether it's throbbing pain, stabbing pain, sharp pain, burning pains, or any type of pain, it's the frustration, isn't it, that keeps us awake, and it's just so exhausting. And I notice that quite a lot of my patients, put off going to bed, or leave it to later and later and later because they think they won't sleep. So what's the point of going to bed? So I think that kind of sets up that vicious circle that we associate our bed with not sleeping. And so that's what happens. It creates that vicious circle. So what a really good tip is to do, I'm not saying it's easy because it isn't, but it's about changing those negative thought patterns relating to our chronic pain and sleep. And if we can change those, it'll improve our sleep. And so often people say, oh yeah, it's all very well you saying that, but what can I actually say to myself? What can I do? I think positive affirmations are really quite good. So if you can almost imagine yourself laying in bed, really cozy, really warm, really relaxed, closing your eyes, and just imagine that you're having a good night's sleep is always good. And that you imagine that when you wake up in the morning, you feel rested and refreshed. Now, the reason, it sounds a bit weird, but the reason it works is because our unconscious mind accepts what we think. And so it says it's true. And so that ability to transform those negative thoughts into positive thoughts is actually really quite good for a whole load of areas. So if we keep repeating that positive self-talk, like those positive affirmations, slowly, that our negative beliefs will change, and we will end up getting more sleep because these beliefs are beginning to unravel, and they're being replaced by our more confident and more positive beliefs. And because of that, we have these new neural pathways that are developed which interrupt those old unhelpful patterns. And then because these new ideas sort of take hold, they become much more useful in getting a good night's sleep. So things like positive affirmations could be anything like, I give myself permission to go to sleep, because quite a lot of people lay there waiting not to go to sleep. I will let go of all my fears and worries. What's really useful is if you sort of say it sort of five times, but each time do press on a finger, so it kind of reaffirms it. It's almost like anchoring, but it kind of reaffirms it. Things like may my dreams be peaceful, may I feel relaxed and happy, with gratitude I accept good sleep. All of those kind of things. That can be, I think if you make your own, they're more useful, aren't they?
That's right. So basically, go towards what you want to achieve and use those affirmations, but don't use the words about what you're experiencing. So if you were to say, I'm going to experience less pain, you're actually allowing your conscious brain to focus on what you want to walk away from, really, aren't you?
Yeah. So it's more as if I'm going to have a relaxing night's sleep, or even accepting that you're not going to sleep all night. It's I will sleep tonight. How much you sleep, it doesn't matter. You sleep some. So it's about not setting up expectations, but changing it to a more positive angle. And that then you like I say, those new pathways start to develop because the unconscious can't tell between real and imagined.
Fantastic. So look, can you believe we've already been talking over 20 minutes? It just goes so
quickly, doesn't it?
It does. We've got a number of people who've been watching us live, so thank you very much for everybody who's been watching us live. If all of you, so many tips that we've got here tonight. Obviously, Sue is going to be posting below the links to that website, which sounds fantastic, and also the links to her book, which obviously is available to purchase. But also, from all of the tips that Sue's been sharing with us tonight, I love the positive affirmations with the anchoring, with the neuro-linguistic program. I love that. The fact that not taking yourself too seriously and allowing yourself to do a little bit at a time, and keeping your own sort of diary of how far I've come towards my goal. And then the whole, if we're in chronic pain, doing those positive affirmations, and more importantly, finding your own way of how this is all working for you, and not comparing yourself to anybody else who might be a chronic pain sufferer and thinking, well, if it worked for them, it's going to work for me, because you're an individual. And this is really what you're saying, Sue, isn't it?
Yeah. I think everyone finds their own way. Like I say, do ask for help, because there is help out there. Don't suffer on your own. Reach out for people, because they will help. But I think value yourself. Work out try all of these things, but work out what works best for you, because different things will work better for different people. And as long as you find it useful, you like doing it, you're more likely to carry on doing it, so you can manage your sleep and pain a bit better.
Oh, thank you so much, Sue. That's been fantastic. And for everybody who has been asking for this session for the last couple of weeks, I'm hoping that there's a couple of strategies in there that you haven't tried, or maybe you were told about a while ago and you just sort of like put it to one side, and this may be a little bit of a reminder. And obviously, as Sue said, if you don't want to post in the public group a comment, then Sue has very kindly offered, please just PM her directly. You can obviously tag her in the group and say you sent her a PM, and then she knows to go and look. Jane,
yes, please do
that. Jane said, thank you both. You're very welcome, Jane. It's been lovely bringing Sue to all of you here tonight. So we have Sue coming back in a fortnight. She's coming back in not next Friday, the Friday afterwards. So if this has sort of like triggered you and thinking, oh, I don't actually have pain, but I have this, or, you know, this, and this feels as though this is stopping me, then please post in the group and tag me. And it's something we can talk about and see whether Sue has got some information to share with us about that question, that topic. So that just leaves us to say, have a lovely weekend, Jane. Have a lovely weekend, Jane. Have a lovely weekend to everybody else who's watching us live, and have a lovely weekend to you, Sue. Thank you so much.
Thank you very much. Thank you. Sleep well.
And you. Bye.
Bye.